run and get a refill of coffee, but we are going to be respectful of everyone's time and get going today. I anticipate we may still have some audience members trickle in with us. But thank you to you early birds who were up and at it, making the most of your extra day of the year, right? How do you leave today, everybody? My name is Laura Stewart. I am the Vice President of Community Development at the Forsyth County Chamber of Commerce. And in that role, for those of you who I have not yet met, I have the pleasure of serving as the staff liaison for the Healthcare Association of Forsyth County, which is an initiative of the Chamber of Commerce. And so part of that piece is that we have a strong partnership with our Northside Forsyth campus here. I'm so grateful. I was sharing this morning with some folks. Some of you probably remember this. Some of you were probably here when we had it, our first session back in person in the Bennett Education Center after we had been shut down for a while. And so it's so nice to be able to kick off another year back in this space. I'm really grateful for Northside's partnership and for them continuing to welcome us here into this space. I've asked my best friend and Northside Forsyth Representative Kathy Galbraith just to say a few words of welcome to everyone and get us going this morning.
Good morning, everybody. Thank you so much for taking time out of your busy days to join us. Of course, hopefully you guys can spread the word. I know it's tough. We still have challenges with the workforce, but I encourage you guys to take time, come in. We have wonderful speakers and great topics that can enrich, your office and the workflow flows. And of course, you all out there virtually, you're missing out on a great breakfast. So I do encourage you guys to attend. We have three more this year. So hopefully you guys, when you see the dates come out, you can join us the next time and spread the word. Thank you again for joining us.
Will you guys join me in thank you, Kathy, and the team here that to get this page ready for us. Again, on an extra day of the year that they're doing that. So Kathy mentioned our virtual audience. We do have a virtual component of this, and we are currently live streaming this session. So for those folks in the room, please do continue, like I mentioned, to grab more breakfast, grab more coffee. Restrooms are out of this room to the left and another left down the hallway there. So if you need that, if you are in person. When our facilitator begins and getting some engagement from you guys, handling any questions you may have, we do have another one of these mics in the back of the room. We have one in the front of the room. Because of our virtual audience, please do be thoughtful about grabbing a mic from myself or my colleague, Jesse Martin, so that they can hear us. To our virtual audience, Jesse is manning your experience back there, so if you have questions, please feel free to put those into the chat for our facilitator once we get our program underway. I did want to make mention that this entire series, our Practice Manager Roundtable series, is made possible by our presenting sponsor, Brandywine Printing. And I've asked Derek Brooks with Brandywine Printing just to come and share with you guys a little bit about why he's here and not actually another chamber commitment happening this morning that I know that he could be at.
Thank you, Laura. Yeah, so I was supposed to be, I know Kathy mentioned workforce, I was supposed to be at our workforce collaborative meeting at the chamber office this morning, and Laura asked me which one of these I was going to be at, that one, which I love and passionate about, or this one, which I hate to be at. So I chose y'all. So my name is Derek Brooks with Brandywine Printing. Brandywine Printing only exists to help other organizations succeed, and we do it by providing printed materials that either improve their image or make them more efficient. And so we've been, I guess, companies or organizations in Forsyth County have trusted us with their brand since 1982 when my dad started the company. So who was here last month or last quarter? So y'all may remember that I tried to make y'all laugh and you didn't, and so I told a joke and you did. So I didn't think that we were going to have to do that again. I've had a couple people ask, they were excited to hear what joke I had, and I was like, uh-oh, I don't have a joke. So now the pressure's on. I will have a joke moving forward, and I actually do have one. So how can you tell a nurse is having a bad day? That's good. No, she's constant, they're constantly needling people. All right. There was a response. Just wasn't the one I was looking for. I'll keep working on it. Thank y'all very much.
Thank you guys for helping me thank Derek for his sponsorship, maybe not the joke. Okay, so in lieu of our topic of reputation management, I do need to kind of talk about my friend Derek here. So you guys know he is a local business here, right here in Cumming. And when you talk about reputation, Northside does utilize bring line printing and even from a physician flyer type materials. And the one thing Derek and I were talking about recently is that the quality of his work. So a lot of times people may create something on Canva or different formats, and it could be not just here or anybody in this room, anybody that sends him, let's say, a non-quality file, he is not going to print that. But he has people on his team that will make sure that file is good quality. So of course the printing is of good quality. So his reputation out there is represented of good quality. So just kind of talking about reputation, that's why we like working with Derek, because I've worked with other printing shops that will just print something and next thing you know I get it back and it's completely fuzzy and I just wasted, $500 or no size, just wasted $500. So anyways, I just kind of wanted to say that obviously he's a great resource, great communication, very quick. I mean, not that I should say this, but when I'm like, hey, I need something like in 24 hours, I get it in 2 hours. So we appreciate working with you.
Thanks, Kathy. Yes, please give Derek another hand. Also, I'm going to ask you to help me thank some additional sponsors, in addition to our presenting sponsor, Brandywine Printing. Our healthcare heroes, Apple Spice Catering, you're enjoying some of their breakfast this morning. Central EMS, probably a great partner to many of you in lots of spaces, and it's important to them that they deliver these business education component topics to you at all as well, so they have invested as a healthcare hero. And our care sponsors, Hallmark Home Care with Andy Roberts. Andy is up here at the front, so please connect with him before the day is out. And Dr. Ben Miller with Dental Partners of North Georgia. Same thing there here, not only to invest in the topic, because I think it's certainly something that's applicable in your world as well, but also to connect and engage with you guys. So please be sure that you do that before you leave. Now let's get on to our topic of reputation management and all the facets of that. Our discussion today is going to be facilitated by Lauren Funk of TL Funk Consulting. Lauren recently retired from Longstreet Clinic, where he served as Chief Operations Officer. Over his 30 years with Longstreet, he was responsible for facility development, information systems, and overall clinic operations. He recently started his consulting firm to help physician practices and other healthcare organizations with their operational challenges to provide strategic direction. Lauren is husband to Michelle, dad to David and Lily, Zachary and Jacob, and in his most important role, as he shared with me, he is pop to Miles Lauren Milo Funk. Please join me in welcoming Lauren to the Forsyth County Healthcare Association.
Since you just heard me call, obviously my microphone is working. But can you hear me in the back? Right. Thank you so much for having me here this morning. Yes, I have maybe gone on to the dark side of consulting. I'm the person that I always made very bad comments about as a practice manager for so many years, but really hope that I'm in a place that I can help just because I've been there. I've done a lot of these things over 30 years. Obviously, you can tell that I must have started when I was 12. Actually, I was a little bit older than that, but had a wonderful experience at Longstreet Clinic and learned so many things. And one of those things that I was able to work on, and I apologize for all this. Okay, so one of the things that we did was to implement a reputation management solution back in 2009. everybody can still hear me? Good, all right. So, we did this solution, in 2022, and so it's really, a good opportunity to share with you some of the things that we did and how we did them. Some of the things that, maybe I would have done differently. But overall, I think it was a very positive experience, and we saw so much benefit from it, even just a few months before I retired. So, just some ways in which I'd like for us to engage today. I want us to engage, especially the people in the back. Definitely, I'm gonna point to you more so than anybody else. But stop me with questions. Don't let me forget that we have the online audience, so I want to be respectful of them as well. But please stop me, ask me questions. I want you to answer my questions as well, please. So, because I want this to really be helpful for you as you're evaluating what can be a really important decision for your practice. So first, tell me what kind of practices are represented. Primary care, surgical,
Ophthalmology.
any OBGYN? Good. Any oncology? Oh, cool. All right. So, a nice cross section. And, I'm also happy that, Dr. Miller is here. I told him, when we were talking a few minutes before, that, that I actually may mention, dental practices. So, I hope I'm nice. Do we have any physicians in here? Okay, all right. So that's one joke I can't say. I'm just kidding. I want to get something. So, and one more thing. I'm really happy that my friend Lisa Blanchard is here. I was hopeful to have a familiar face in the audience. I'm really glad that she's here. And I know that y'all enjoy her too. We've been friends for a long time. So for today, I want you to keep in mind a couple of things. Think about the reputation that your practice has. What people say about you in the community. What they think about when they think of Dr. Such or primary care associates, whatever it is. Then, for our discussion today, does that match up with what is showing online? Is that really a good representation? What you believe about your practice is what's shown online. So, our agenda today is one, why do it? And I'm going to show you just some nice graphs and things that I found online to give build a base for why you would even do this, why you would even consider starting with a reputation management solution. Then what it is, and then just some practical things about choosing a vendor, tips on how to implement it well. And then one of the important things is this is the part, like the title of the presentation is more than Google reviews, star ratings, and surveys. The opportunities is the more part. And that's really the part that I'm most excited about, really, when you talk about developing your reputation, because you're giving the opportunity for your patients, for your employees, to tell a story. And people love a story. So that's, we'll talk a little bit more about that. So why is the reputation so important? So I was wanting to balance this between one that's kind of like, good, just how quickly a reputation can be ruined. Have you ever experienced, or maybe heard a story, it's usually about restaurants that are just beat up by a bad experience and can affect their business, definitely, right? Anybody seen one of those kinds of reviews? Have you ever gotten a review that you would think, oh my goodness, what is this? What is this about? But if you can think that, it takes so long to build a good reputation, but 5 minutes to ruin it. Do you think that's accurate? But what are some of the benefits of a good business reputation? Can you really increase your revenue? Do you think that's realistic? Improve employee retention? I think so. I was listening in on, the conversation right over here. You were talking about, how you find staff and how hard that is. I mean, we're getting beat up all the time, but we just can't even get the people in the door to work for us. But what you say, Derek? What's your?
Hire slow and fire fast.
Yeah, hire slow, fire fast. But, even getting them in the door is hard. Just getting them to respond to opportunities. Lower marketing costs, that speaks to letting your patients, letting your customers tell your story. Again, attracting that top talent, getting a competitive edge. We're all friends here, but we compete. We collaborate on a lot of ways, but sometimes we compete with other brands. So that's a fun situation to be in. We can also strengthen our customer loyalty and build company value. But if all of these things are benefits of a good reputation, again, I think we need to be realistic and think about that if it's a bad reputation means flat or decreasing revenue. We can't get anybody to work for us because they see how horrible a place it must be if that's the way that we treat our patients. That's the way we treat our patients. So it's big. So what are we seeing online? 98% of people read online reviews for local businesses. 98%. That is such a high number that it seems unrealistic. But I was careful to try to get information from online, away from specific vendors, reputation management kind of solutions. So this Bright Local is actually a consumer surveying tool and company based in Great Britain, and they do extensive surveys. So they do this huge survey every year. So you'll see a lot of these slides. But even if it's 90%, even if it's 50%, my goodness, that's so much more than what we experienced before. I know all of y'all are a lot younger than me, but did anyone ever have the experience of trying to figure out what kind of ads to put in Yellow Pages before you practice? Yes, it's hard. And it got worse and worse as it went along, because it was just terrible. To now the point is, we just 2 or 3 years ago, the last physician that thought it was important for us to have a presence in the Yellow Pages retired. Up until that point, I was pretty much, we just got to keep on having something in the Yellow Pages. But now, nobody cares. Because now, they're going online for everything. And notice too on this part about the 37% of consumers only leave positive reviews, and only 6% negative reviews. So, I don't know, I've seen a lot more negative reviews than I would like to. Another interesting thing too is the 91% of consumers trust online reviews as much as personal recommendations. What do you think that's a symptom of? I don't want to think it's because people are not connected, but.
I always think we do consistent, public for patient care. And I'm looking for a doctor, and I go and read the reviews, and I see a consistent method of good, you tend to trust that. Or then if you see consistent, you're waiting 2 hours to see this job, or, front office is absolutely rude, and you see that comment over and over and over again, you tend to trust that, so that 91% is how you believe that.
maybe there are some other factors as well in that, you can get a lot more. It's a lot of trouble asking 10 people, but you know, you can go online and get that pretty quickly. And I do think that part of it is just that, when you're moving to a new town, you don't know anybody. Plus, it's probably a little bit easier to talk to someone about the last restaurant they went to and ask them about, hey, did you like that? As opposed to, hey, I need something cut off. Where would you go? You know, that's a little more of a problem. So yeah, we're gonna go with it. All right. So the other thing is Google is big. Google is the most used and trusted platform for reviews, and not just businesses, all businesses, but for healthcare too. You'll see that. So healthcare, 66% of consumers use Google for reviews on healthcare. Now there are those other, the online, I'm thinking mainly of health frames, which is specifically for healthcare and looking at reviews and how doctors and hospital systems and everybody are rated on that. But for the most part, people use what they use for everything else. So who knows? They may be thinking they're looking for a doctor at the same time that they're looking for a dog. It's just probably speaking to how ubiquitous Google is. Does that surprise you at all? That people use Google that much? It doesn't, because you're almost younger than me. It really surprises me. Let's click. Yeah. That's right. Whatever is easy and quick. So another support for this is how important a part do online reviews play in your decision to use them for the following industries. So basically, 84% say that it's important or very important in using online reviews for choosing their healthcare. So they're doing it. They're getting out there and doing it. Another thing that's very important in looking at reviews is people are looking at how they respond. They're going to respond, or if a business responds to a negative or a positive review, either one, that is going to drive whether you're likely or not to go there. Why is that? Why does that make a difference? Right, care about customer satisfaction. I mean, even the one about responding only to positive reviews, that's still a good driver, because isn't there a tendency to think that, okay, well, we do our surveys, we do them like we're supposed to, we do them, but you may not always do something with it. One of the rules that I always remember from doing any kind of survey is don't ask a question about something you can't do anything about. You know, one of the offices we had a horrific problem with parking, and there was just nothing I could do, really. So I didn't ask about that, because I knew it. I didn't need them. Excuse me, I know it's being recorded. I knew that it was awful, and I was doing everything I could to do it, but there was no need to ask about it. But to know that people are responding and know that someone is actually there listening makes a big difference. Which is really interesting. This one actually did come, it was a survey done by one of the vendors that we evaluated. But I just thought that was extraordinary, that after receiving a response about a negative review, that 63% went back and left a positive review. Now, okay, so who is the person that added up the numbers and knows that they didn't come up to? So of course, you could have multiple responses on this. So you could have answered, I removed my negative review and I followed up by creating a personal review. But again, even if that's just 30%, I mean, that's a tremendous impact on responding to an incident in a way that makes a customer happy. In fact, that theory has a name. You probably know about this, but I didn't know that this was what it was called. It's called the service recovery paradox. So the service recovery paradox, situation in which the customer thinks more highly of a company after the company has corrected a problem with their service, compared to how they would regard the company if non-faulty service had been provided. You're creating a better, more loyal customer by improving or correcting their service. The main reason behind this thinking is that successful recovery of a faulty service increases the assurance and confidence from the customer. So I think that's something that we kind of know it happens, but had anybody ever heard of the service recovery paradox, that actual term? You know that term? Okay, I don't believe you.
I studied this topic as well. So,
Oh, really?
Yeah, because everybody has this young, of your age, so this younger generation, they communicate mostly by text.
Right.
Our generation was more word of mouth, pick up the phone, we had to do the customer service, try to get the situation rectified. Well,
Right.
now they can get customer service by email or texting or different formats that we didn't have. And when that is rectified, their way of word of mouth is to do it digitally. And so they want that dialogue. It's just not like this. It's this.
Yeah.
So it's just the way it is.
Right. So let me rephrase that and make sure that everybody heard that.
Yeah.
That it's really that it's important to this generation that they're able to do that digitally and not just the way in which we used to do it by phone. We're still having a dialogue.
Yeah.
So I've been working on some things with getting a provider set up with NPI, Medicare number, and all that kind of stuff. And if anybody is a really good Medicare provider enrollment specialist, I would like to talk to them. You have, when you go and need help, which I always need help, of course you can call, but they really are trying to not get you called. But the online chat is really the way, because you're going to get a response right now. You'll get somebody in 5 seconds, much faster than you call. So I started doing the chat. I'm trying to get used to that. Plus, it's kind of cool because you get documentation of what has been answered, and they can more easily give you resources that they really kind of interesting. That's just one. So the key elements of a good review, we talked about of course, the star rating, giving those ratings indicate the quality, but some of the other things like the volume, you want to have a lot of reviews to look at. So the flip side of that, you go look at a physician or you go look at a practice, and there's not a lot of reviews. You kind of think, well, are they still there? Are they still in business? Comments, those are the things that are really helpful because comments really give a part of that story and can help you understand more about why they gave you the ratings that they gave you. It's really easy to go through and play 4 stars, of course, because we're all nice people. We don't want to give anybody 1 star. So you're good, 4 or 5 stars. But when you put a comment with it, that gives it even validity. Recency, patience, you might have a lot of reviews out there, but if they're 3 years old, that tells them. And again, like you said, you know, the engagement, people are looking to see that things are responded to. So we know that people are reviewing and leaving reviews online. They pay attention to those reviews when they make decisions, and they'll even change their mind after they, if it's ever. So, what was the story about why we even implemented a reputation management solution? One of the things is that we didn't do a good job of surveying. We just didn't ask at all. We didn't have a good system for doing it. If we did one, it was really kind of haphazard. And if anything, you know, you really need a long period of time to measure issues over. So that was one issue. The feedback that we did get came from the contact us form on our website. Aside from people calling and, you know, being in person, but I guess the electronic online came through the contact us form. So that was being managed by our marketing and PR firm, and they would, you know, alert us to anything that was on a contact us or Facebook posts and things like that. But that was really just very clunky, especially when you're dealing with somebody that had an issue, and unfortunately many times it was not dealt with quickly. And there was really no accountability for the staff, and because we just didn't have a good system. We had a problem, we didn't create a system to correct it, as we were talking about a little bit before. So that was a real issue. It was just very haphazard. And then, you know, when you look online, there's really not many of our providers that had star ratings or any reviews. So we didn't have volume. We didn't have recency by any stretch, and the engagement was really lacking. So that's what led us to move towards evaluating what I would call a solution, a system that helped us manage this process. So before we go there, this is a high-level description of what reputation management is. It's how healthcare organizations and all organizations are able to control the influencing, enhancing, or concealing of the organization's reputation. The tool allows the practice to capture patient feedback moments after their experience, celebrate the positives, and address the negatives to enhance overall patient experience. So looking at that real quick, is there one word that jumps out at you that might cause pause? Concealing? Yeah, I wasn't really sure about that, because I don't want it to seem like that we're hiding anything, but maybe we can kind of flesh that out as we get it through. I'm good with influencing and enhancing. That's good. But the concealing, you think, you know, I don't want to hide anything, because if we were hiding something, we wouldn't be dealing with those negative situations. So, other systems, the common components are going to be the surveys. Those surveys are going to come, or the request for a survey, usually through email, text, the IVR, the voice response system. So give plenty of opportunities for the patient to respond. Give them, you know, you'll go through the process too, as you're evaluating, deciding how they're going to get those requests. Are you going to say, okay, I'm going to email them first, if they don't respond to that in 2 days, then I'm going to do this, and I'm going to do that. So that's part of that implementation process. The other thing, of course, is the reviews and the star ratings. So you want them to not only fill out a survey, but then you have a system, or part of the system's functionality is giving patients the opportunity to leave a Google review, or, you know, something that's going to be syndicated on to not only your website, but the big sites like Google, Yelp, system will also help you in collecting all of those reviews and syndicating them everywhere. I love that word, syndicating. That makes it sound so marketing rich. So, again, the consumer platforms like Google and the others. So, I mean, they make sure a good reputation management solution will make sure that it goes everywhere. And they're watching it and knowing what people are saying. So a typical workflow is that, of course, on day one, you've got the encounter with the patient. Then after that, they're going to receive that request for a survey. They're going to complete it. Almost immediately, those survey results are available for you in the system for your staff to review. And then they're published on the website, and then they get out to where they're on the other syndicated sites. The other part that I mentioned that was really important for us was adding this functionality where you need to have a very systematic way to be looking at the reviews that are coming in each day, flagging the ones that need attention, good and bad, and being able to distribute those issues and concerns that need to be addressed to the people that are in the best place to address them. But that's going to be different for every practice. So for us, Long Street Clinic is pretty large and lots of different departments. So it was very important for us to have a very organized and systematic way to make sure that those reviews got to the right people, because those were the people that could really solve it. So that was going to be the practice manager for orthopedics when there was an issue that. Does that look, do you think that looks accurate? That makes sense. So what happened? Our average provider rating became 4.75 out of 5 stars. It went down. Across all of our locations, we went from about 2.7 average star rating to 4.5 across all of them. Of course, significantly increased the number of online reviews and the number of 5-star reviews, the better response time to service, and issues in that systematic accountable process. So that's real stuff.
So what do you just didn't have a review, or when you had a negative, you needed to kind of
Right, exactly. So she asked why was it only 2.7? Is because there were so few reviews and the preponderance of them were negative. We had a couple, 2 or 3 positions that were really doing some innovative things in marketing their practice. They had a good handle on it, but they were the first champion of implementing this solution because they saw the impact of it, and it made it easier for them personally for their practice because everybody was doing the same thing. So everybody got on board. Yeah. But one thing that I was not, I didn't test this or measure this, but the vendor that we went with, one of their selling points was that they saw across all of their customers that even an increase of 1 star in your average rating could mean a 3 to 5% increase in rating. So, you want to believe that to be true. Please, but. So now some of the practical things. When you're looking at the vendors, there are so many out there. I started looking again just in researching for this topic. There are so many different vendors. There's healthcare specific ones, and then there are the vendors that may have healthcare clients. So just, if you're considering those, you might just really think about what you're looking for and what the solution is going a match for you. We don't do the CAPS survey, but, you know, my guess would be that a health-focused kind of company would be better able to help you in the CAPS survey if you're, you know, a hospital-based practice, or a, you know, physician practice that's within the hospital system that has to do with CAPS. Coordinate your efforts with your website developer, because you want to use that as part of your tool to and that's part of your overall digital marketing strategy. If I can, just a plug, they asked me to do a session at Georgia MGMA in May, and so it's all about the whole digital marketing strategy for your practice, of which reputation management is a part of that. But your website developer is a big, big partner with you on that. And also your health system provider directory. So that's one of the things that we saw when we were working with Northeast Georgia Health System on their provider directory. They implemented a new system. And we noticed all these other providers had their star ratings on there. So, well, what the heck? How did they get those on there? Well, this is how. We partnered with our reputation management solution and the provider directory solution to be able to have that interaction to show our star ratings on the provider directory as well. So that was really good. I would choose some metrics to evaluate the success. Of course, you're going to get the metrics about your improvement in star ratings and things like that, but maybe there are some other specific things that you want to measure. Maybe you have a provider that you're trying to get going, their practice is new, and so maybe you can start to see if there's any impact on the kind of the number of patients they're getting, the increase in revenue, things like that. But it's, you know, you want to do that at the beginning so you know what you're making. You're going to be asked and have to determine a plan for your survey questions, what questions you ask. They're probably, when I say the company, your vendor, will have a set of questions that they usually ask the patient, and I think that's what we went with. We just went with the base. You know, y'all are the experts, so y'all know which ones to ask, because you want to ask them over a consistent, long period of time, so you can see the improvement in it. You're going to determine the frequency and the encounters that trigger a survey. So that's why I asked about the oncology patient and maybe OBGYN. So just think about how many times one patient visits you in a very short period of time. You're not going to send them a request for a survey every time because they'll get tired of it, right? So you just got to think through that process about, okay, this is they've not been here in 6 months. So I think I want to give them another survey. Make sure they can serve. So those are the kind of questions you have to think through and ask about that. I would designate an internal champion to help you with the details of implementing this solution. Talking to practice managers, you're going to be a part of it, but you already do too much. You already do a lot. And it's good to have a partner in this process. So that's my I'm a dad and a granddad kind of advice. Assign who will be responsible for monitoring the survey results. So make sure that you've got a plan. You know that, okay, we got it implemented, but now comes the real work. So who's going to be looking at these results? How are we going to get the information out? Who's going to deal with the service issues in this department? How is that all going to go? So go ahead and get that at the beginning so they can be a part of the process of implementation. And then, of course, determine how you're going to communicate to staff and providers. This is where you involve, even before this, but involve your providers. Because it's one thing as a practice manager for you to hear something about your practice, but as a physician or a nurse practitioner or PA that is seeing a patient one-on-one, and they get a ton of negative review, that's a lot more personal. So you want to make sure that they're part of the process of implementing it. Seeing why it's important, because I know that they want to know. Sometimes it's hard to know, but they want to know, because they want to be able to give that best service. All right, so I think that was all of those. So to wrap up, these are the opportunities. You want to amplify the voices, both positive and negative. You're giving people a voice. So you're amplifying the voices, so you make sure that you celebrate the positive things and deal with the negative. And that's where you get your actionable data. There may be something you didn't know was a problem. And this is the way you find out about it. So I am very thankful. You know, sometimes I think, oh gosh, I can't deal with something else. But I'm very thankful to know that there's a way for me to find out things that need to be fixed. Because, you know, your patients want you to be good. They want to help you. So this is, you know, honor them in that, saying, hey, you really need to work on it. So thank you for helping them. Let patients help you tell your story. That's where I really like all the stories, the things that you hear about that you may not have otherwise known. And celebrating your people, you get to hear the story about somebody that, you know, they were just, you know, they were so sweet. You know, I was so upset about this diagnosis, but this person was so sweet, y'all went above and beyond. You may not have known that, but that is an opportunity to celebrate that person who you may not have known about. So one of the practice administrators that really embraced this whole program. So not only do they have a plan for how they are dealing in their department, that they're dealing with the service issues and concerns. They also have a plan for when someone is called out as an employee and how they're celebrated. I mean, that is a systematic way in which they're celebrating their people, and I think that's an awesome way to. Yes, ma'am.
So these are first immediately responses to comments.
Mm-hmm.
So important. With Long Street, did you make sure those responses, integrity of those responses are held? Did you have canned responses, pre-planned responses? You know, when you see like, you know, the positive, thank you for the positive, survey or for the comment or whatever, or did you let them pre-form a response back to the patient, or again, if it was an issue, of course, that needs to be handled a little bit different way.
Right. So asking if we had a planned way to word and how we responded to both service issues and positive things. So thank you for your response. And I do not know the answer to that. I think that it seems like that's part of the system. The system functionality itself, that it may have given an automated response to that immediate thing, but then, you know, you're going to follow up in real. But that's a good question. So, yeah.
You can do auto responses,
Yeah.
which are a lot of businesses do that, but then you see the extra comments and things like that, and I think, like, you know, as we're educating people,
Yeah.
the person that's in charge of that is very important as to who
Right.
that person is, or who you coach to do that, or give candidate ways to handle that.
Right.
Because you want to make sure those responses are positively or negatively handled in a certain way, because that, the outcome can go one way or the other. And I'm sure everybody knows ChatGPT, so people are, you know, needing to respond a certain way. And all about ChatGPT too.
Yeah.
You know, make sure those responses look very professional.
Right. Exactly, yeah, that's a very good point.
It's a free form.
Yeah, yeah. So you want to make sure that the, people are trained well, in those, responses. Okay, yeah, that's a good point, yeah. Any other questions, comments? Yes, ma'am.
Do you know how long comments stay on like Google or something like that? Do they fall off after a certain amount of time? No.
I don't think so.
I didn't think so either, but.
I mean, you can, yeah, you can remove them. I don't know how that's done. That's one of those things that, that do over here, that is happening somewhere. I can remember too, though, that before we implemented this, solution, we were trying to manage some of those reviews. We would try to remove them. So I don't think it's not as, reliable as we might want to see.
I was wondering, because we had a provider that retired, and some of the negative reviews came from the provider retiring, which we had no control over. And how do you need all these positive reviews to offset those.
Right. Right, exactly.
Yeah.
I think we had another question back here.
It wasn't a question, it was to go along with, that, so there are certain companies that you can pay to remove them, but like, you can't, it's like, moving yourself.
Right.
I know, you have to like, kind of buy a separate company to make those.
I have a question. So if you guys look like, I don't know if you want to say Amazon or multi-care healthcare, when you're looking at a review, when you're looking at a review, and how far back do you look? Like, okay, like, are you looking at reviews are only within the week, within the month, within 3 months, within the year? So, like, shout out, like, how far back do you think when you're reading and looking?
So I moved back to Georgia after being gone 18 years. I moved back last December in 2022. And we didn't have a dentist. We didn't have, I still don't have a primary. We didn't have anything. And I was so involved in the medical community in Baton Rouge, it was easy for me. I always knew who to go. So I only looked back 6 months. Because being in the healthcare industry and the turnaround and the turnover, I know 6 months is pretty on average how many people that I knew were at different companies. So for me, I looked back 6 months when I was channeling that. And then a lot of people don't take new patients. I was on like a 4-month wait list for dentists. I will talk to you later.
There's no way.
It was very challenging. So I saw, for me, it was also like ability. Like, what did they have in common with me? One of the guys was from LSU, and I went to Georgia, so LSU was a competitor, but I just moved from Baton Rouge, and that's who got me. That's what I was able to get in with. But you look at all different things. But the review did matter to me. I was looking at all of them.
I'm just curious about how far.
I go back 6 months.
Okay. I would say I'm like a 3-month person,
Yeah.
you know, partly because of the time I have to put into it, and then like the relative portion of how many reviews are there, and you're kind of scrolling, I would say that's kind of like a 3 month, maybe 6 months, depending on what I'm looking for.
Yeah.
So I was just curious to see what everybody else kind of looks at.
I should have done that.
Well, it's funny because I did have to take my daughter a couple years ago to Coachella, and of course, I should have looked at reviews, and I didn't. And not to bash Coachella because they are wonderful. I had many great doctors there, but it was kind of weird that I could get in within a week. And it was a specialist, and it was not a great experience. When I got back, I looked at the reviews, and it was like years of negative, and I was like, no wonder, you know. So I kind of kicked myself.
Which solidified that reviews matter.
Yeah, they kind of do help for sure.
Well, and sometimes people look at the stars and really don't even look at the review yet. They filter out from the stars first. Okay, now let me look. These are all 5 stars and 4 stars. Let me look at those, and the other ones don't even count yet. I'm just focused on these.
Good point.
I actually, when I look every single review I look at, I go and look at all the negative ones first. And I will go back to a year.
Yeah.
So I start with the negative ones and I go up to the 5 stars, see what the difference is, and see if it's a consistent problem with the negative reviews. If it's like all over the board and all different types of negative, I'm like, okay, and then there's all these that outweigh it. And that's how I think.
When I do like these products, of course, I think we all, like, I instantly go, like, I filter 4-star and above, and then start looking at products, and then I will look at the review that says, like,
I don't know, or even like, if, you know, people grade something like a 3-star, I kind of go to the middle, because I want to see like, oh, okay, these might be the normal people. Like, let me see this, you know, I'm not gonna look at the ones that are like, you know, crushing everybody, and people that are so happy, I'm like, I'm gonna go look at the middle, so, yeah. That's kind of interesting.
What are their reviews, like, do they relate to me? And do I think that's a problem as well? If they have a negative review or a positive, is that something that I'm looking for? If it's not, I just move on.
Somebody gave me advice a long time ago, the people that actually write like, I don't know what they have books, but you know, like in the comments, like those are the ones that like more read, and because they add more detail, and they just
I think we have a question online as well that came through, so Jesse's going to read that for us. Okay, so this is from Dr. Jason Lingold. He's a cardiologist, so he actually has 2 questions. He wants to ask, how do you address the balance of providing a personalized response versus a HIPAA concern?
Oh, I don't want to answer that. I'm sorry. Personalized response versus, yeah. Well, you're certainly going to be careful in not putting something down that will be HIPAA related. But you know, as far as the, I'll keep me in line here. But you're talking to someone in your provider's office that is a part of your care. So of course that's all protected information. So I guess is the question about a comment that might be, or like a review that might be?
Yeah.
That's what really is the review.
The review.
Those, you need to clean those up. So that's part of a good system too. Cleaning those for PHI. So the systems will usually flag those using, I'm sure that they're using AI, so we should call it that 2 years ago. But using AI to scrub those reviews. I'm sorry, I was a little wrong.
That's good. We had one more too, about the review. So he said that he thought you could only send 1 review to 1 platform, but what are the top 2 platforms after Google?
Yelp. Yelp, and according to just the overall business consumer reviews, it was, Google, Yelp, and Facebook.
Any other questions online, Jesse? No. Another question in the room?
So my question is, I'm part of the North Science System. So I think there's over 300 practices now. If they wanted to do something as far as implementing reputation management software, we use Pressgany now, which is great information, but it comes in quarterly. Nothing that we can, address immediately. A lot of times we don't have a name. Most times we don't have a name where we can address a concern to that person, where we can get that information directly to them. What would they be looking at for a cost when they have that many practices to implement something that would be useful for us? I have 3 reviews on our website, and 2 of those 3 are for a doctor that has retired.
Yeah.
So we do have 5 stars.
So I don't know, so I can't answer really specifically on a cost kind of deal, because the standards are going to be different. Pressgany definitely is one of the big dogs in this space, and they certainly have a specific reputation management solution in addition to all the other surveying and things that they do. To give some, I guess it's okay to say from a provider standpoint, the solution that we were looking at was around $1,000 per year per provider. So, now, that's all about scale that kind of gives you just a, kind of a ballpark. Plus, it also depends, because usually, you know, there's gonna be different parts of the solution, and you may not want all of them. You know, you may be able to handle, you know, this section, you know, without having to provide a solution for that. So that's gonna affect your cost.
Right, any other questions? One more?
For smaller projects, do you think that, instead of starting with the surveys per se, do you think that response to the Google, reviews and things that are already out there would be a good starting point?
So say again what you're at, like, as opposed to doing surveys and.
Right, and instead of starting with the answer company to do that for you with
Yeah.
surveys, could you
Yeah.
start with, would it be okay to start with responding to the Google reviews or something?
I think that that's a fine solution, but one of the things that is, the reason that you do that is to first start off with the information in a survey that gives you the best opportunity for a positive. Because if outside of a survey and giving them an opportunity to do something positive, that's why you're gonna have mostly negative. So that's great to respond to those, you need to, but that's the way that you're going to, if that's a way to communicate your service issues, that's really only solving half the problem. Of course, you want to respond to those reviews, but to really work on your reputation, it's going to be, you've got to have enough positive reviews to amplify that. So as maybe in a stepwise function to do that.
Well, everybody, will you help me in giving Lauren a positive review? I was to teach it up for you.
All right, very good. I'll do that.
Really quickly, before we close our live stream, I did want to make mention, Kathy mentioned the upcoming event, and we do host these roundtables quarterly. So our next session will be on Thursday, May 30th, and we're kind of flipping the script, you guys. We're going to be focusing on conflict de-escalation. The Healthcare Association has an advisory council that meets regularly, and we need to help determine our programming. And from those leaders in the space, this was something that they really felt that we needed to focus on. So we are going to have Sergeant Terry Hawkins with the Forsyth County Sheriff's Crisis Prevention Team join us and walk through kind of some de-escalation de-escalation of conflict tactics, as well as what are the next steps? If it's not moving in that direction, what should you do? How should you prepare your team? So please be sure to join us for that. With that, we will close our live stream because we do have a couple of items in addition to the breakfast that those folks missed. So hopefully those folks can join us in person. But for folks who are still here, we do have a couple raffles